Center cannot hold. Things fall apart, the center cannot hold. After Daddy Lumber's demise, there's a whole lot of controversy on the internet. It saddens my heart. Ghana has lost a great and a powerful man. Instead of us to honor this man, instead of us to mourn with the family, some people are making a joke out of it. Please, a country called Ghana, what are we doing? Every country is watching us. If we cannot honor this great man, what are we doing? During one of Daddy Lumber's concerts, he mentioned he had a spine surgery. In that, he mentioned Mama Echampon's name. He mentioned Nanechum's name. They were there to support him when he needed it. Me and you should ask ourselves, who is going to be there for us when we need help? Who is going to be there for us when we need someone to pay our hospital bills? When we need someone to take us to hospital, who will be there? These two people were there for him. A country called Ghana, what are we doing? What are we putting on the internet? If we cannot honor this man, if we cannot help the family to go through the pain, please don't make a joke out of it. Let's take a minute to honor Daddy Lumber. A minute of silence, please. Thank you, lovely viewers. My name is Abena. Here is POMAA Health TV. On TikTok, AbenaNurse387. Follow me for your health information. Today, in honor of Daddy Lumber, I'm going to talk about SCI, full meaning spinal cord injury. Spinal cord injury is a damage to your spinal cord. Spinal cord runs from your brain to your lower back. Your spinal cord carries a nerve signal. This nerve signal runs from your brain to the rest of your body. Let's talk about types of spinal cord injury. We have cervical spine. Your cervical spine is in your neck. We have thoracic spine. Thoracic spine is your upper back. Lumbar spine is your lower back. Sacral spine is around your pelvic. If you have injury to any of these, what are you going to experience? So if you have a cervical spine, it becomes difficult for you to move your head and your neck. I have watched one of Daddy Lumber's video. You can also check the internet and watch it. When he wanted to move his head, he has to move the whole body. Yes. If you have injury to your neck, this is the result. It can also affect your arms and your legs. You can have numbness and tingling. You can also paralyze. Thoracic spine. Your thoracic spine, it becomes difficult for you to breathe if you have injury over there. It can also have effect on your bowel and bladder function. Your lumbar spine becomes difficult for you to stand or walk. You can paralyze as a result of that. Your sacral spine can also make it difficult for you to move your bowels and bladder. So these are effects that can happen to you. And Daddy Lumber once said he was sitting in a wheelchair he sat in a wheelchair. Yes, you can paralyze. If you are lucky, you are able to walk again like Daddy Lumba was able to walk and do most of his activity when he was alive. My brothers and sisters, a country called Ghana, let's learn something out from the things that the Lumba put out there. And let all of us move away from the negative information that is going on. Now let's talk about causes of spinal cord injury. Accident-related cases account for 37%. Yes, there's a research that shows accident account for 37%. Fall accounts for 31%. Violent-related cases account for 15%. Sports-related activities account for 8%. So me and you, Daddy Lumba is dead and gone. Me and you, what can we learn to prevent ourselves from being part of the 37%? Accident. Please, when you are driving, put your seat belt on. And if you have your kids with you, make sure they have their seat belt on also. In a country called Ghana, our roads are bad. Please, fix it. Fix the roads. It's very bad. Especially Lake Road, Jache, Pramso, Kontase, Swadro, going to the lakeside. Please fix the roads. There's a lot of accidents going on. What can we do to help? Daddy Lumba got someone to pay for his medical expenses. Are we thinking about the poor who cannot even feed themselves a day? If they find themselves in these situations, how are they going to pay for their medical expenses? Please fix the roads. It's been there for years. I've come on vacation several years. The roads still remain the same. I've been to Ghana several years for vacations. Anytime I go, the roads still remain the same. Fix the roads to prevent accident. Falls. Please make sure you don't pour water in your house, because you can slip and fall and break your back. Make sure you organize your house in such a way that you are not going to bump into anything and fall. Because when you break your back, when you break your spine, you are going to be paralyzed. Daddy Lumba said at some point in time he was sitting in a wheelchair. You don't want to be in a wheelchair. You don't want to be. So please, arrange your house in such a way that you don't fall. And to the nurses and the STNs out there, follow rules and regulations to keep our patients safe. Violent-related cases. If you are out there and you only solve problems with guns and sharp objects, please stay away from it. I've seen a lot of young boys at the hospital paralyzed as a result of violent-related cases. Parents, we want our children to look after us when we are old, not the other way around. You don't want your son to be paralyzed and you end up taking care of them. Watch the kind of friends your kids surround themselves with. Make sure they are not involved with people who deal with issues with sharp objects and guns. Sports-related activities. Please, let's all make sure we wear protective clothes that is appropriate for every game that we are doing. Let's use diving, for example. Please, make sure it's safe to dive, because you can hit your head, you can hit your back and end up paralyzed. These are the positive things we can learn from what Daddy Lumba said. Let us not dwell with these negative comments that's going on. This program is sponsored by POMAA Essential Rentals. If you are in Ghana and you are looking for quality chairs, look nowhere. POMAA Essential Rentals. If you need good machine, A+, quality chairs from US, money box, mattress, anything you need for your wedding, engagement, naming ceremony, look no further. POMAA Essential Rentals. Greetings to all the nurses who support me. Nurse Selena, greetings to you. Nurse Kate, 2 Nikki Squares, Nurse Farah, greetings to all my nurses. Bye-bye. Are you having pain or soreness in your calf? Yes, I'm asking you. Are you having pain or soreness in your calf? You may be experiencing signs and symptoms of a certain disease or a condition that you know nothing about it. So sit with me, don't go anywhere. Let's talk about it. By the way, my name is Abena. Here is POMAA Health TV on YouTube. On TikTok, Abnanes387. Information on your health education, tune in to POMAA Health TV. If you are out there and your doctor has diagnosed you of a certain condition or disease and you need more knowledge about it, send me a comment and I will give you more information about it. Today, we are talking about DVT. I know it's medical terms, big words, but I'm going to break it down for you. DVT is deep vein thrombosis. Let me come back to a layman terms. DVT is a blood clot in your deep vein. Blood clot in your deep vein. Normally in your legs, or it can also happen in your arms. But most of the times it happens in your leg, but it can happen in your arms. This condition is serious. Yes, DVT is serious. It's serious because blood can loosen and lodge into your lungs. Yes, and I'm going to walk you through the process. When blood starts to clot in your leg, it's going to travel from your leg all the way to the right side of your heart. From the right side of your heart into your lungs. Yes, that's how the process starts. And this is serious because you can develop a condition called pulmonary embolism or a disease called a pulmonary embolism. Since we want to focus on DVT today, next time we'll talk about pulmonary embolism. It's serious. This is serious. Now let's talk about signs or symptoms of DVT. If you are home and you are experiencing what I just talked about, and you are like, how will I know I have DVT? This is the signs and symptoms that you will notice. You are going to experience pain or soreness in your calf. That was why I asked you in the beginning, are you experiencing pain or soreness in your calf? Yes, this is one of the symptoms of DVT. Swelling on the affected area. Do you see there's a swelling on your leg, or in your leg you feel it swelled over there? Yes, swelling is one of the symptoms. Warmness. When you touch it, do you feel warmness over there? Yes, warm or warmness is a signs and symptoms of DVT. Discoloration on the skin or discoloration of the skin. Yes, do you see that your skin, the affected area, is turning red or purple? Red or purple, depending of your skin color. So if you are white or black, then you will see the kind of skin color it will show on the affected area. Yes, these are signs and symptoms of DVT. So if you are home, all of a sudden you are experiencing warmness in your leg, swelling or soreness on your calf, redness, purple color, warmness, these are signs and symptoms of DVT. Don't sit at home and get a cream somewhere and think you are going to rub it on it and it's going to go away. The first thing you should do, if you are in US, I would say call 911 and go to hospital. Or if there's somebody at home that can drive you to hospital immediately, do that. If you are in Ghana or wherever you are watching me from, I will tell you, rush to the hospital, don't sit at home. Like I said earlier on, the blood can loosen and travel or lodge into your lungs. You don't want that to happen. This is a serious condition. I don't want anybody out there to go through. I know sometimes when you don't have knowledge on certain things, you may end up developing big or complicated diseases. So if there's a way for us to avoid all these things, let's continue to watch POMAA Health TV, get more knowledge on your health so that you know what to do immediately it happens. So the next thing is we are going to talk about causes of DVT. Yes, we know blood cannot just clot in your leg. There should be a reason, or you have to do something to cause that to happen. So let's talk about causes of DVT. The first thing we'll talk about it is lack of movement. Lack of movement. And the examples I will give when it comes to lack of movement is going to be someone who drives for long distance. The next one will be someone who travels through airline, or someone who is in bed rest as a result of paralysis. These three things can make someone develop DVT. The reason being is that when you drive for so many hours without taking time to exercise, without taking time to stretch your legs and arms, yes, blood is going to clot. When you travel by airline, anytime is safe and you don't get up, you sit for 9 hours, 10 hours, 6 hours without making any movement, there's a likelihood of blood clotting in your leg or in your arms. The next thing is someone who is paralyzed. When you are paralyzed and you are always in bed, you are lacking movement. You are not doing anything. That's why as nurses, we have to make sure we are turning them every 2 hours. And the therapists out there, we have to make sure we are giving them the exercises they need so that we can prevent DVT. The next thing I'm going to talk about it is age. Research shows that when you are older than 60 years, it puts you at risk of developing DVT. But bear it in mind, DVT can happen at any age. It can happen at any age. But when you are 65, it puts you in a risk position. The next one we'll talk about it is birth control pills and hormonal therapy. If you are out there and you are taking birth control pills, you are taking hormonal therapies, it increases blood clot. So there is a likelihood of you developing blood clot. Yes, you can develop DVT as a result of you taking birth control pills or hormonal therapy. The next one we are going to talk about it is weight. When you are weight or when you are too heavy, it puts pressure in your veins, in your pelvic, in your legs. The pressure that your veins, your pelvic, and your legs are receiving can make blood clot. So being overweight can make you develop DVT. Being pregnant, yes. Pregnant women go through a lot. DVT can happen to someone who is pregnant. The reason is you are carrying another human being inside you. It puts pressure on your veins, your pelvic, and your legs. It's the same thing like someone who is overweight. So the men out there, please, treat your wives good. They go through a lot. The next thing I'm going to talk about it is personal or family history. Maybe you or someone in your family has developed DVT before. There's a likelihood of you also developing it if you are in the same family with them. So personal or family history, yes, you can develop DVT on that. What can we do to prevent DVT? Before we talk about preventing DVT, let me bring this one in. If you have had injury or surgery in your veins, yes, you can also develop DVT because that will interfere with blood. Yes, blood clot. So there's a likelihood of you developing DVT. And smoking, I don't want to forget that. If you are someone who smoke a lot, please, smoking interferes with blood flow and clot. How blood flow in our body and how it clots. Smoking interferes with it, and you can develop DVT as a result of that. What can we do to prevent all this? Please, if you are someone who drives for long hours, make sure you take time, park the car somewhere, walk around, stretch your legs, do a little bit of exercise before you continue your journey. And if you are there taking birth control pills, hormonal therapies, talk to your doctor. Do it in a safe way to prevent DVT. Let's stop smoking. If you are out there and every day you are smoking, some people can smoke 2 packs, 3 packs, and still be looking for more. Please find a way to reduce how you smoke, and if possible, quit smoking. If you can, quit smoking. It's going to be good for you. Thank you, lovely viewers. This program is sponsored by POMAA Essential Rentals. If you are having a wedding, engagement, naming ceremony, funeral, anything you need for your program, reach out to POMAA Essential Rentals. They have good chairs, machine, generators, mattress, money box, tent, anything. They have everything. That's why they call them POMAA Essential Rentals. Essential means you are number one stop. Everything you need, you go there and you get everything you need once. You don't want to make different trips for the things you need for your program. Just go there once at a time. You get everything you need. POMAA Essential Rentals. Bye-bye. As we go about our daily activities, a lot of people are experiencing nausea and vomiting. Yes, and they have no one to turn to. They are experiencing nausea and vomiting because they are lacking certain vitamins in their body. And lack of these vitamins makes it